Three, two, one. Welcome back to another episode of AT Talks. This is topic 4, things I wish I knew when I started. This is episode 3. This is our 29th video, and we have 28 YouTube subscribers, so the ratio is less than 1. But we have 5 athletic trainers. We have Eli, we have Natasha, we have Matt, Ashley, and Dr. Nick Spangler. You might know Matt from TikTok. He's blowing up right now on the Twitters. But if you could quickly introduce yourself, I would appreciate it.
Yeah, I'm Matt Shear. I'm currently a collegiate athletic trainer at Mount St. Joseph's University in Ohio. Anything else you want? Cool deal.
My name is Nick. I work in Indiana. I work underneath a chiropractor in a physician practice setting.
Okay, I'll go next. My name's Ashley. I currently work as a collegiate athletic trainer at Texas A&M Corpus Christi.
Natasha, go for it.
All right. Thanks, ladies first, I guess, or sort of. I'm Natasha. I work in corporate healthcare, and I design medical education. And I also teach intro to athletic training classes at the community college, and I'm in California.
Nice. My name is Eli Kasab, and I'm an athletic trainer kind of in transition. I work in the collegiate setting right now, but I also do PRN work with Brazilian Jiu-Jitsu athletes and kind of just sort of experimenting with different areas. So, yeah.
All right. Who wants to start off on things they wish they knew when they started? What would you, if you go back in time, you could tell yourself something, what would you say?
All right, I'll take it. I'll start. I got it. Because I got one on my mind, and that's basically, one thing I wish I would have known was how difficult some of the athletes can be to deal with. Because like when you're an undergrad student, it's like, okay, like here's rehab and treatment and modality, and like here's how you evaluate an injury from start to finish and return to play. But what they fail to teach you is how to actually deal with the different personality types. Well, both good and bad, but some of the like more difficult ones to deal with. Until you really don't know how to handle it until you basically get out into the field and you run into the athlete who is just a difficult athlete in every form or fashion. That was one of my biggest things is that's one thing I wish I would have learned a little bit about, and just kind of how to handle and manage it. And of course now over the years I've had enough experience where I've kind of dealt with all types. So now it's a little bit easier, but starting out, man, I was just kind of caught off guard. I didn't really know how to deal with it. I thought everything was simple. Here's your rehab. Would you rehab? They're like, okay, thanks for getting me healthy. I appreciate it. No problem. It doesn't always go that way.
Yeah, definitely. I think like that was probably one of my biggest eye openers too, because like, especially when you're a student, that's the way it usually is. Like someone comes in, you give them the rehab or you do the treatment. Like sometimes they complain about what's going on, but then like when you're in charge, it's just like, okay, like then you have to like figure out the personality types. Like you got to figure out like, okay, who's like not necessarily the toughest, or they're just like really sensitive to pain. So like it seems like they come to you every single day with something different versus like the person who doesn't want to say anything, and you're just trying to figure out like, okay, like they kind of say like it's bothering them, but is it like bothering, or is this like actual like a scale of like it's like a 7 on the 1 to 10 scale? And then also like kind of piggybacking off of that, it's like trying to figure out all the different personalities, like especially like with me working with a collegiate team, there's so many different personalities between the 25 people that I work with. So then you have to like kind of figure out what makes each person tick, and then like you have to realize like the way that you're going to treat one person is different than the way you're going to treat another person, because the two of them just respond completely differently or are motivated by different things. Like some people don't want to say anything because they have the impression of like, oh, you're just going to hold me out if I tell you that I'm hurt with something. And then others, like you kind of have to, like they'll be out for something and then you have to like kind of like push them like, no, you're okay. Like it's going to be okay. Like you can get back into doing stuff. So I definitely piggyback off of Eli. Like that's probably the biggest thing, just because we didn't have to deal with any of like all those different personalities and everything when we're students, because our certified athletic trainers, our preceptors, were mainly the ones that dealt with that.
Yeah. I think one thing kind of almost semi piggybacking off of that I wish that I had known was like how to schedule treatments and like time management, because like during my first year last year, like I was like, okay, like I got this, but like doing it in a collegiate setting around classes where they're like, okay, well I'm free, my classes are at 9, 10, and 1:30. You're like, okay, that there was no gaps in there. Like, so like where, at what point am I able to schedule those? And then next thing I know, I have 10 guys coming in, all needing treatment, but it's during pre-practice time because no other time works out. And so being able to slowly figure out like, okay, let's get someone in and out like 15, 30 minutes with a strong dedicated rehab, and put them to work while being able to like maintain that personality and get that buy-in from the athlete has been one of the biggest things that like I had wished that I learned. Because when you're a student, you just sit there and like you show up to clinicals and you're like, okay, cool, who do we have going in? But then you don't see like the background of the AT or like your preceptor, like, okay, doing all this time management. Like, okay, so I have so-and-so coming in at 11:15, and then at 11:30, someone else is going to come in, and so on. So
Going off that, and this is something that Tom, you and I think Bryce talked about, is kind of like networking and, you know, getting to know your community, getting to know kind of the people within your school. And I think this is pertinent, not just at like a high school. I think it goes for collegiate or even other settings. When early on in your career, especially because of our profession, a lot of people don't know who we are. You can't take it when people question your decisions or they question, you know, what you're doing. You can't take it personally. You have to understand that this is an opportunity to educate people. Hey, I'm the athletic trainer. This is what I do, and explain. Hey, here's X, Y, and Z why I'm making this medical decision. And because I think 90% of the time when people are opposing us, they're coming from a place of ignorance because they just don't understand. And very rarely are people like, oh, I just hate athletic trainers, or oh, I just want to be a pain in someone's butt. Like if you're reasonable with someone and you try and educate them, they're more than likely going to buy in. They may not immediately buy in, but if you kind of explain it and give them some time, they're going to come around. And then if they don't, that's a whole nother issue. But generally speaking, I think most people are reasonable, and looking at that as an opportunity to educate and not, you know, get flustered or be combative about it. Don't take it personal as like they're attacking you. Understand that this person just doesn't understand what I do, and I need to explain that better to them.
Yeah, and I think like not all the time it's like they're trying to say something personally against you. Like sometimes it's not because they don't understand like what you are as an athletic trainer, but sometimes it's based off of like their previous experiences with athletic trainers, or especially if you are talking with coaches or administrators who have been in the game for a long time. So it's like when you're trying to explain like a knee injury or something, like they're going to have that bias in their head of like, oh, well, this person had this injury that like looked like the same thing, and this is how this went down. Like I know, like especially with me working women's soccer, I see that a lot with ACLs. Like, oh, well, this person tore their ACL and they got back in 6 months. Why is this person taking longer? And like that education part really comes in. Just explaining, like, especially with ACLs right now, like a lot of the research is changing, or like every person heals at a different rate. Like even if it's something as simple as a fracture or a muscle strain or something like that. And just being able to acknowledge, I think the biggest thing is like acknowledging, like, I understand where you're coming from. I understand whatever frustrations you have, and then giving them the education, because then, and especially like playing with them, like we're all on the same team. Like we all want this athlete to get better, or we want this patient to get better, and we want them to improve. And these are the steps that I think is going to like lead us to the most success in order to help them.
Natasha, what do you think?
Awesome. I was just going to jump in too, so I appreciate it. I mean, I agree with all of that. I feel like we all came from that environment where like you go from, you know, not having your own kind of thing to having your own thing. But I will age myself, I was like the last class that took the original BOC with like the
With
three
the
different
practicals.
sections. Yeah, exactly. Yep, putting stickers on different anatomical areas. So coming from that, like we did when I was like a student athletic trainer, we did have a lot of like our own teams. Like we would get an entire water polo team, and although like it's supposed to be low injury, it's still like, oh well, I'm in charge. So we got a little bit, I feel like, more experience that way. But then I feel like a lot of the focus was on your patient is your athlete and your athlete is your patient, where the thing that I wish I would have known is the different career trajectories that we can have as athletic trainers, kind of going into like performance and the military and service fields and different things like that. And I'm speaking obviously from area right now where I'm working for a corporate company and I'm not seeing patients, I'm not doing any of that, but I'm using my education to create curriculum for, medical, different medical conditions and things like that. So just knowing that, and I mean, I'm in California, so here, part of me not knowing these different career fields that we can possibly go into and like learning as we go, I came back from my master's program and was offered positions at $15 an hour, and in California, like that barely covers gas. So
Yep.
yeah, so it was hard. Like I was down on myself, like, oh my gosh, I have a master's degree, I now have 3 or 4 years experience, I've had my own teams, all of this stuff, and trying to search for jobs. So just kind of that, and I know they're doing a lot of that at the like different conventions nowadays and things, but just going in and having your program really go over that stuff, as opposed to learning about it as you're trying to search for jobs. I think that's what I wish our program would have done, because I mean, I'm sure with most of you, as far as the clinicals go, it was just different teams, different settings, as in high school, collegiate, junior college, and then maybe a PT clinic, but you don't go anywhere else. So I think they're doing more of that now, but I wish I just knew more about that before job searching and trying to figure out what to do with my life as an athletic trainer.
Round two. Anybody else have anything that they wish they knew?
I'll piggyback off. Oh, I'll piggyback off the job thing and just say something I wish I knew. And it's, I think when you come out of whether it was undergrad or you come out of grad school, whatever degree track, I think there's always that pressure that I need to get a job. And when you're in those interviews and you're getting to the point where you might be getting some job offers, I think that sometimes we feel pressured that they have all the leverage, that like, oh my God, I have to take this because if I say no, like what happens, then I don't have options. And I think the thing I would tell my younger self is that you do have leverage, because if you think about it from their side, they've invested time into your interview. You've probably had at least a phone interview and an in-person, depending on how rigorous they went. They've narrowed it down to probably a select number of candidates. So for them, they've invested time and resources into vetting you and saying, this is the person we want. So if something about that job, perhaps, there's something about it that you're saying, maybe this isn't as good as I would like it to be, or if this aspect of the job would change a little bit, or if I can negotiate this, that would be better. Don't feel pressured into saying yes. Understand that, hey, you know what? They also want me, so I need to negotiate a little bit and say, hey, you know what? I think I'm worth a little bit more, or I deserve more vacation, or whatever aspect, or if I'm moving across the country, they should maybe reimburse me for my moving fees. Or understand that you have some leverage in that decision. It's not all that, oh my God, I have to take this. Understand that, they've put time and resources into you. So use that to your advantage, and don't feel like you just have to take a job because, oh my God, like I need to find a job after school because loans. And understandable, yes, like financial financial problems and the finances that come with school are a real thing, but don't feel like all the leverage is on their side. You have leverage in that situation too, and you should be able to say no if something doesn't feel right or comfortable about a job.
Yeah, I know I've definitely gone into job interviews and like I was really trying to find a position because like grad school was getting ready to be over, and I was like looking around, I was just getting desperate, and I did go on like a couple on campus or have like phone interviews, and I'd get off of them and I'd be like, like maybe that didn't feel right, like I didn't like this about the position, like whether it was the pay, whether it was just like the interactions that I was having with the people. And I remember feeling like pressured, like, okay, well, like this could still be a job. Like I need a job because I'm like about to finish grad school. I'm going to have student loans and everything. But then like realizing as I like kind of moved on from some of those experiences for one way or another, and like looking back, I'm like, man, if I had taken that, like if they had offered, I probably would have taken it in the moment just because it was a job. But like I would have been freaking miserable. And like that's not worth it. Like just because there's so much time and investment and everything that we pour into our job. Like we're not just like, even if you're working in the corporate setting or even if you're working in the different settings, not just in educational, but like we're investing a lot of time and a lot of effort, and there's so much that goes on. Like we owe it to ourselves really to make sure that we're in a good position.
I remember, just to piggyback off of that, and then I'll add another little like tidbit to it, is I remember when I finished grad school, one of the first job offers I got was in a collegiate setting, Division I, full-time position, and the offer was like $18,000 a year. Right? I know.
No, I know.
I had to
It's like probably interviewed for one or two.
So anyway, but I ended up turning that down, and I was just because I was kind of in a mentality of like, okay, that's a little extreme. Like I can do better than that.
Yeah.
But I think another thing, like I would have liked to have known or told my younger self, like Nick was saying. I think for me, it's I wish I would have known more about how much athletic training can consume your life at various levels. Obviously, there's, like Natasha, like we're to different settings, right? There's industrial, military, like, and so I think just having a better understanding of each setting, and then what the sort of time commitments are for each one of those. I didn't really realize, and it's kind of a little bit what I'm experimenting still with now, but like, I think just realizing how much of a time commitment it is at like in every type of area in athletic training, and how much it can really, consume you all the way from like professional level all the way down. And, because that's definitely something that kind of caught me off guard when I got into it. I knew it was busy and long hours and stuff, but I didn't realize how much it can potentially, handcuff you at times. Obviously, it depends on your setting and your industry and your, where you're at, but. Yeah.
Hey guys, a quick plug. Well, not really a plug. Have any of you visited the NATA Career Center? I work in there every year. Okay, awesome. So I kind of like from these conversations, I'm kind of taking some things that like maybe we can in the Career Center we can improve and like post or have maybe like people come in and talk to others about it, because I feel like a lot of, at least for me personally, and from what I'm hearing, a lot of the things that we didn't know were, or things we wish we would have known, were things related to career searching and career development and all of that. So I'm glad to hear someone visited. But yeah, I hope to see you guys in Atlanta this year. I'm a key volunteer in the Career Center every year, so come visit.
I think I want to have a shirt made that says AT Talks, and then make everybody mad that I'm not wearing a dress shirt and tie.
That's awesome. Hey, if you have them made, I'll sport one.
I'll snag one.
Yeah.
Matt, do you have a round two, something you wish you knew?
I had one, and then I had one, and then I totally blanked on it after.
You were thinking about your next TikTok. That's why.
Yeah, I'm trying to think. I got all these memories and all these ideas, but yeah, no. Yeah, I'm kind of lost. If I remember it, I'll come back to it for sure.
Okay. Anybody have a third thing that they would tell themselves? I know Nick does.
I know I have one.
Yeah,
Anyone
so
else?
go ahead, Nick.
Okay, this one is more specific to maybe the physician practice, the clinic setting where you're working with other healthcare providers. Specifically, if you're working with someone who's kind of supervising you directly, I think you have to understand that you're going to go into that setting and, when you're in the high school setting or maybe collegiate and athletic trainers are all you work around, you can kind of call your own shots more. You have more autonomy as a practitioner. You make more decisions. Whereas when you're working physician practice, that's the physician. You may have some input, you may have some influence. He may ask you for your opinion, but I think you have to understand you're losing some autonomy in that sense, depending on the physician you work with. The other thing is that because physicians, depending on the setting, they do get pretty specialized. There are going to be things in the history taking or within the documentation or within the examination that you're not going to be prepared for, where you're going to have to learn those things on the job because that's how that physician is going to want things done. And you have to be humble because there are going to be areas, even within the orthopedic realm, which I think we are very, very good at, you're going to be outclassed or out-knowledged in some areas you didn't realize, and you have to be humble about it. You have to take it and learn from it and grow. And I think that you should want someone that's going to tell you, like, hey, this needs to be better, or hey, like, you could learn in this area more and I'm going to help you, or here's how I can help you. You want to be around those people, but you have to be humble about it. You can't take it as, oh, they're attacking me and they're calling me stupid. No, they want to help you, but they can't help you if you don't accept the fact that, you have room to grow.
And that was an issue I struggled with in undergrad because I always felt like I was ahead of the curve, ahead of the class. And then when they would give me that critical feedback, I would get upset. It's like, what do you mean? I'm like, I'm killing it out here. It's like, no, you're okay, but you can get a lot better here. You get a lot better here. You get a lot better here. Just relax, take it in, and grow from it. It's great advice.
Yep.
Did you think of it, Matt?
Yeah, so I think one of the biggest things that I'm kind of running into more so this past fall, because I mean I'm only in my second year as a certified, so a lot of these things I'm still trying to learn and sift through, and when it's like, oh, what would I tell my younger self? It's like I'm still there, but at the same time, I think a big thing is, and kind of piggybacking off of Eli's point about how much athletic training absorbs your life, being able to how to effectively create the line of the work
Boundaries.
and I think, yes, you can call it a balance, but at the same time, I've heard a quote and I've really liked it, and it's when you want to be good at something, there isn't really a balance at all. Balanced isn't always perfect, and so just kind of taking that, but also trying to figure out what line do I keep with my athletes in terms of open communication and being able to when I close that door to the AT room and I turn on my car and I start heading home, and maybe I spend that 30 minutes reflecting on how the day went, what I could have done better, and and maybe kind of lightly plan for the day ahead tomorrow. And then once I walk in my front door, just kind of shutting it off, has been a big learning point, at least this year for me, just because being so close to my athlete's age, I think a lot of them see me as almost a friend, but I still have to be able to draw that line so that I'm staying professional, but also so that I can have a life outside of athletic training as much as I love it. So
yeah, I think making sure that athletic training isn't taking up our just our entire life and kind of ruining everything. I actually went, our school was hosting kind of a mental health thing that I went to, and it was actually really interesting because we spent almost half the time, talking about if athletes or just patients are in distress, because it was there were counselors there and people from the career center and anybody who works with students, and you start to see warning signs about oh, they may benefit from counseling, or something's going on, and making sure that you're not just taking all the responsibility for that. Like big part of our job is referring, like, oh, okay, like I think you have a broken bone, you need to go to an orthopedic, or hey, like you're sick, you need to go to like a general practitioner. Like part of that is the mental health. So that was kind of like half of the talk. But then the other half of the talk was like, you have to be able to take care of yourself in order to be able to perform your job effectively. So some of the things that we talked about, and I really like started thinking about it, was you need to start learning like what your triggers are for when like you're starting to get like off balance. Like, okay, here's like when I start to like feel like kind of like my cup is running out, like these are the warning signs, like, and things that I notice, like I'll start like kind of getting snippy with people who like don't come in when they're supposed to, or like I go home and I start complaining about like stupid little things to my significant other, and then realizing, okay, these are like my warning signs for like I don't have anything else to give. So then what are the things that we can do to kind of restore ourselves? Because if we're running on like an empty cup, or like if we don't have any gas in the tank, like we're not going to be able to effectively treat our athletes. So as much as we care for them, we have to care for ourselves too. And that comes with the creating boundaries. Like some of the things I have are like, they're not allowed to text me after a certain time, or like I tell them like, hey, I'm going out of town this weekend. If any of you call me or text me, like I'm not responding to any of it. Like I'm not looking at it. I'll see it in the office on Monday. If it's an emergency, call 911, because you all should know how to do that. So I think like being able to like create those boundaries and making sure that you're taking care of yourself in the process, because otherwise we're not going to be able to take care of them.
And I think also being able to let yourself like mentally be okay with like setting those boundaries and not feeling guilty is like a big thing that like I've started to try and like really learn in the past few months. Like it's okay for me to like not respond to the text at like 9:30 that I might think is like very, very critical to the athlete, but like in reality, like it can wait till I wake up tomorrow and I do everything that I need to and I step in the office.
Yeah.
And then real quick, because I know we're running out of time, we got 4.5 minutes left, but I just real quick wanted to piggyback off of Matt from the work-life balance sort of thing. One thing for me personally that I've kind of like learned over the years, and it's kind of how I view it, but it's looking at it as, instead of work-life balance, for me it really helped was looking at it as like work-life integration. Because I for me it's like work is such a big part of our lives, where it's essentially is what it is, it's integrated. And so it's, for me, it's been really trying to find a job or a career or a setting or whatever that really integrates into the life that I want to live and create, versus trying to really separate the two. Not saying it's right or wrong, but it's just something that I've kind of changed my viewpoint on, and it's kind of helped me kind of better find I guess a balance or integration, depending on what viewpoint you want to take on it. But so that's kind of, at least personally, that's kind of helped me sort of reevaluate and kind of better navigate, the career path, and like find settings that a little bit more lined up with, how I want to live my life. So.
Yeah, I really like that. Yeah, I was just gonna say I like that, Eli, especially since I feel like that kind of leads into one of the other things that I wish I would have thought about more or known when I was going through undergrad. And even after undergrad, I worked at a high school as an athletic trainer before going to grad school. And I always thought like, oh, it's educators versus those of us that are clinicians and that are practicing, because I was like in it, and I was, gung-ho about I'm going to be, a clinician for the rest of my life. And then, I got married and I have a little baby now and all of this other stuff. And so, again, like finding that, not necessarily balance, but finding that life that I'm comfortable with. So for me, I work, I want to say 9 to 5, but it's not. It's 6:30 in the morning till 3:30, and Monday through Friday, and it's perfect for me. And I work from home, so I get to, be with my kiddo and all of that good stuff. So, and I'm still in the medical field. I'm still teaching classes. So for me, again, it was finding that area of where I still felt valuable with my athletic training background and everything, but was comfortable personally and professionally. And so I think the thing is for me, networking and talking to everyone and understanding everyone's background, because now with my research, I just finished, I think I said this on the last talk, but I just finished my doctorate last year, and finding people to research with and finding people to talk to. I reached out to a lot of my clinician friends, and they were like, oh, you're just in education. Like, I'm not going to give you the time of day. And I started thinking back on, like, was I like that when I was a clinician? Did I say those things? Did I do those things? So just, you know, kind of to my younger self, like I should have been more open, because now as an older adult, you know, I kind of go back and I'm like, oh, well, you know, this is a little bit different than what I've done or that someone's done. And so just having those relationships and kind of knowing what everyone does and what's out there and the communication, I think that's important. So again, I appreciate these conversations just because I think that that gives us all an opportunity to learn, you know, so that when we're even older, we can be like, oh, I wish I would have told myself this, but I did, because I was on this talk.
So next time when we have the talk, I need to introduce you as Dr. Natasha Denmark.
You can.
Oh, I'm sorry then. Yes, I didn't know. Even though we talked earlier, I'm sorry.
Yeah, you're good. I go. You can call me whatever you want, as long as it's not.
All right, we'll call you doctor next time. But we're any second now. This is going to boot us out because there's a 40-minute limit, because this is the free version of Zoom.
Oh gosh.
So thank you for coming on and talking about this. Then I would like to have you guys back for future topics. I've already had Nick and Eli and Natasha on more than once. First timers, Matt, Ashley. But thank you for spending time on your Wednesday with us.
Thank you.